do. And so we're joined this morning by Dr. Gina Williams as she wants to discuss the annual enrollment season and tips for maximizing your health benefits this year. Good morning, doctor. How are you doing today?
Good morning. I'm doing well. How are you?
We're doing great. Let me ask you this, doctor. The importance of empowering people with health information. This is a massive system. It's a lot of turns and
Hmm.
variables in it. Uh, it, it it's scary for people, isn't it? It's almost unapproachable in some ways.
Right. It can be very overwhelming, and that's why it's important for people to feel empowered with information so that they can learn about benefits that are best for them and make the right choices in terms of plans that have the right benefits that fit their lifestyles.
Well, and speaking of plans, you have a dual special needs plan, DSNP, and it talks about how it provides you with everyday needs like healthy food, even utility
Mhm.
bill helps, over-the-counter products. Talk to us a little bit about that and why it would be so important.
Sure. So people who have both Medicaid and Medicare may be eligible for a dual special needs plan, and we call those a DSNP plan. And in particular, with United Healthcare's dual complete plan, which is a DSNP plan, people may be eligible for a $0 monthly premium. And generally, these plans are focused on whole person care for people who need additional support because of age, health conditions, and disabilities.
So basically, we're talking about a wellness situation, a total situation more than anything else, correct?
Yes, absolutely. So the unique features of the DSNP plans, and in particular the dual complete plan with United Healthcare, is that there may be $0 copays for things like covered prescriptions, as
Hmm.
well as routine dental visits, vision exams, hearing exams. And then with the dual complete plan, there is a U card, and people get a monthly credit for exactly what you talked about for doing things like paying for utility bills, as well as healthy foods, so fresh fruits and vegetables, as well as over the counter products. So there really are a number of benefits that can be obtained by having one of these DSNP plans.
Dr. Williams, two questions for you. How do you find out
Mhm.
if you're eligible for one of these dual special needs programs? And since you've worked in this industry for a while and know the ins and outs of it, is this a shift we're seeing in how we're approaching this, the wellness aspect of it, the pre-maintenance
Hmm.
side? I think I can remember it being emphasized as much in past go arounds of finding healthcare. It was more about just getting you signed up, getting people to buy into the program.
Mhm.
But now it seems like the emphasis more is on long term general well being instead of prices well being.
Yes. So people can find out more information by going to getdual.com or www.getdual.com or calling 1-800-560-5932. But you're exactly right. So we are really now focused more on not only acute visits when you're sick and you feel like, okay, I need to go to the doctor because I don't feel well, but also on making sure we're getting people aligned with getting preventive visits. So the annual wellness visit is so critical because that's where you get your vaccinations, that's where you get lab work done, that's where you get screened for conditions that you might need to have treated. And so there is a shift, like you said, to kind of addressing total care and then also making sure we're providing benefits that speak to everyday needs like social determinants of health. So making sure people have access to healthy foods and to over the counter products for everyday life because it's not just about acute visits or when you're sick. It's really about how are you focusing on wellness throughout the year, each and every day.
This is brought to us by United Healthcare, and we see this. We see the flood of information and ads on TV. You can't avoid every 2 seconds there's a commercial, and
Hmm.
for me, that stands ripe with a chance of someone being scammed or frauded or paying for services that really don't cost anything. How can we kind of maneuver and navigate this and be sure we're not buying into some scam? Somebody's just taking money out of our pocket.
Sure. So that's a great question. And so in general, for people who have Medicaid and Medicare, you can contact your state agency to ensure that the messages that you're seeing and that you're receiving are accurate and they are associated with actual bona fide and legitimate plans. And then by going to the website getdual.com, you can actually determine what eligibility you have for different plans, and you can actually see which ones are legitimate and hopefully work with a healthcare coordinator to assist with your visits to the doctor, not only when you're sick, but also when you're well.
You know, one of the things that gets me, they always ask about, we need your zip code. Okay, suppose I'm broke as the devil, but I'm not in the proper zip code. What happens then?
So typically, people are asking for your zip code. Number one, to make sure that you have updated information, and so that you can be contacted. So, for instance, if your health plan wants to contact you, or if your state Medicaid agency wants to contact you, it's important to kind of know your zip code, because that's different benefits and different things are shifted based on where you live. But it's typically to make sure that everybody maintains good contact information so that you can be reached about changes with your benefit, and you're maximizing the care received in your particular area.
So I was going to ask about if, we talked about, I want to go back to the preventative side of this. And
Yes.
we talk a lot about wellness and prevention on this show. And so if it's not already in place, is there talk about things like mental health care, making sure people are getting adequate physical exercise, helping them with that? Would that ever be a part of this plan?
Absolutely. So preventive care is critical, and so I'm glad that you all talk about it quite a bit. And so one of the things and one of the features with this Dual Complete plan is the healthcare coordinator who can assist with keeping you on track for not only your physical health needs, but your mental health needs. So there's additional support for mental health care. And then for doing things and in reinforcing the need for exercise and how much exercise you may need, and for focusing on healthy fruits and vegetables and items and products that are more natural and focused on your overall long-term care and long-term health, as opposed to right in the moment when you're not feeling well.
You can find out more about these dual special needs plans. They can provide more help with everyday needs like healthy food, over the counter prescriptions and products, even utility bills. You can find out who qualifies, what does it cost, and how can it help keep you healthier. You can find out all this information by going to their website. Doctor, can you give them that website, the information website for United?
Absolutely. So it's getdual.com, and that's again GETDUAL.com.
The best way to answer it or to handle it is to ask questions. Knowledge is power, and especially when it comes to this,
Right.
don't leave your health up to chance. Don't let a scammer get in your pocket and take your money and pay for something that could be just coming to you. Go to their website, find out more information. Dr. Williams, thank you for joining us this morning.
Thank you for having me.
Anytime, anytime. We'll take